Welcome to my channel. A woman is not as conscious for her health as she is of her beauty. In most cases, girls are not properly informed about their own bodies. In everyday life, there are certain factors due to which girls are prone to deadly disease. However, they may not even think about these common issues. So, in today's video, I will discuss about 5 common mistakes that lead to complex diseases in women. So, let's get started. Number 1. Genital hygiene. Women's genitalia are often referred to as biological machine. That is, women's reproductive system are capable to keeping their genital area clean by themselves. There is no need for us to clean it. Now, you may be thinking, why would there be an illness if the genitalia were cleaned? If the genital area is kept clean and tidy, the person is protected from disease. Let me explain that. The genital area of women harbors various viruses, bacteria and fungus. To protect the genital area from these microorganisms, some fluid are secreted in the vagina. The pH of fluid released in the vagina is around 4 to 5, making it acidic. If the pH level of any fluid is lower, it becomes acidic, and if the pH level of any fluid is higher, it becomes alkaline. So, due to the acidic nature of the fluid released in the female genitalia, bacteria, virus and fungus cannot easily cause infection in the genital area. In this way, the genital area protects itself. Many people make the mistake of using soap, lotion or antiseptic for genital hygiene, which is never appropriate. Soap and antiseptic generally contain alkaline substance. As a result, using soap, lotion or any antiseptic for genital hygiene can disturb the pH level of genitalia, making it less acidic. Therefore, the acidic environment in the genitalia is lost, making it easier for bacteria and virus to cause infections. Additionally, many people when clean private parts use the hand inside the genitalia, which is not advisable. This can lead to various issues such as irritation, rash and infection. It may even cancer. So, the visible part of the genital area should be washed with plain water. Avoid using antiseptics or soap during genital hygiene. Second mistake is sexual intercourse during menstruation. Many engage in sexual intercourse during menstruation. The question is, what happens if one engages in sexual intercourse during menstruation? In the video, the image you are seeing this part of female reproductive system. This part is called uterus. The inner part of the uterus is called endometrium. Normally, the endometrium is about 6 to 8 mm thick. However, 1 to 2 days before menstruation, due to hormonal change in the female body, about 70% of the endometrium becomes thin, and the blood vessel in the endometrium contract, and this time there is the shedding of the endometrium, which we call menstruation. Since the endometrium becomes thin and cells are shed, there is an increased chance of infection in the endometrium during menstruation. Engaging in sexual intercourse during menstruation can increase the risk of both partners contracting sexual transmitted disease or various sexual transmitted infections. As the cells are shed and blood vessels are open, there can be more significant blood loss during intercourse compared to normal circumstances. During menstruation, the risk of discomfort during intercourse can be higher. If someone engages in sexual intercourse during their menstrual period, there is an increased chance of various sexual and reproductive health issues, including infection. This is primarily because the endometrium is thinner during menstruation. Additionally, having intercourse during menstruation may lead to excess bleeding and discomfort. It is worth noting that engaging in sexual intercourse during menstruation is considered prohibited in Islam, as mentioned in Surah Al-Baqarah ayat number 222 of the Holy Quran. So, you can easily understand that sexual intercourse during menstruation is not a good thing. The third common mistake is taking emergency pill. Many people take emergency pill after sexual intercourse. Let's see how does emergency contraceptive pill works. During each menstrual cycle, the release of an egg from the ovaries is called ovulation. During ovulation, when sexual intercourse takes place and the sperm from the males combine with the egg leading to fertilization, the fertilized eggs then implant itself in the uterus, resulting in a pregnancy. The emergency contraceptive pill prevents pregnancy in three ways. Number 1. Emergency contraceptive pill prevent ovulation or delay ovulation, leading to lack of fertilization between the egg and sperm. Number 2. Emergency contraceptive pill make increase the density of cervical mucus, preventing sperm from moving upward. Number 3. If ovulation has already occurred, emergency contraceptive pill do not allow fertilization and implantation to take place. Emergency contraceptive pill primarily contain a high dose of hormonal combination that can prevent fertilization and implantation, thus acting as a for emergency contraception. It is important to note that this pill can disturb hormonal balance in the body, potentially leading to irregular periods or even ectopic pregnancy, which is an serious condition. So, say no to emergency pill. I hope you understand. Number 4 mistake is getting married late. Nowadays, due to education and career reasons, girls do not get married on time. Let's see the disadvantage of late marriage. In woman's life, menstruation being at the age of 12 to 30 years and it typically stops around 45 to 50 years. Each month during menstruation only one egg is released from the ovary, and if that egg undergoes fertilization with male sperm, a baby is conceived. Consider a woman who starts menstruating at the age of 13 and stops at the age of 50. Then her total menstrual age or the age of menstruation is 50 minus 13 equal to 37 years. A woman released around 4 to 450 eggs on average from the age of 12 to 13 to 50. Some may release slightly less or more. We know that one egg is released per month from each ovary. So in a year there are 12 eggs. Therefore, in 37 years, in total is 37 into 12 equal 444 eggs. Now, when a woman reaches the age of 28 but has not had a child, 50% of her eggs are lost. How does this happen? Assuming her menstrual age starts the age of 13 and she reached the age 28. The menstrual age is 28 minus 13 equal 15 years. So, if she released 12 eggs per year, the total number of eggs released is 12 into 15 equal to 180 eggs. We see that the age of 50, a total of 444 eggs are released during menstruation. However, by the age of 28, 180 eggs have already been released, leaving 444 minus 180 equal 264 eggs. It is an average, it can be vary for individual. But even though menstruation may occur a few years before menopause, during the premenopausal stage, ovulation does not necessarily happen with each menstrual cycle. This period is known as the premenopause. During this time, a woman may not release an egg even he is her period. And if she does release an egg, its quality may not be normal. After menstruation, releasing an egg requires the action of many hormones. As the age advances, the level of various hormones in the body can increase or decrease, leading to reduce the probability of egg release as one ages. A lower rate of egg release implies the decreased likelihood of conception or an increase the risk of infertility. When observing this trend in the country, it becomes evident that the rate of infertility is increasing day by day. However, it is essential to note that infertility can have multiple causes and the age factor is just one of them. Even though reaching the age of 28 means you are already 50% healthy eggs are exhausted. This is just one aspect. Delaying marriage for education or career reason is not necessarily a wise decision. It's advisable to manage marriage, career and family planning simultaneously. Number 5 mistake is not drink enough water. The other name of water is life. One crucial component in human body is water, which is contributes 60% of our bodies. If you are surprised, consider that the heart and brain contain 70% water, our lungs have 80% and even our kidneys and bones have water content. It is recommended that an adult consume at least 10 to 12 glasses of water daily. When you do not drink enough water, several problems may arise, such as digestive issue. Insufficient water intake can reduce the efficiency of digestive process, leading to constipation. Number 2. The kidneys play a crucial role in eliminating waste from our bodies, and this process requires an adequate intake of water. If you do not drink enough water, the kidneys may not function properly, potentially leading to formation of kidney stone. In addition, insufficient water consumption can cause burning sensation during urination, yellowish urine, headache and weight gain. Therefore, it is essential to drink 10 to 12 glasses of water daily to maintain good health. Consequently, every woman should be mindful of these 5 points for overall well-being. Otherwise, it may lead to potential health risks. I hope today's video was helpful for you. If you find the video helpful, do not forget to share it with your friends. Please subscribe to my channel to get health advice, health awareness and reproductive health related all the videos, and remember to become a member of our family. Stay with us healthy and safely. Thank you for watching this video.